Hello everyone and welcome to Your Health, Your Choice. I am Dr. Roopnarine. We are coming to you live from our studios at Olira Heights in San Fernando. Today is Wednesday the 18th of January 2023 and on tonight's program we'll be discussing women's health. In studio with me tonight again is Dr. Roshni Bissoondatt. Dr. Bissoondatt is a specialist obstetrician and gynecologist. And Dr. Bissoondatt practices at the Southern Medical Center in San Fernando. As usual tonight, guys, our numbers should come up at the bottom of your screens. And we'll do our very best to answer each and every one of your questions during the program. All right, guys, so let's talk about women's health. And let's say hello and welcome back to Dr. Roshni Bissoondatt. Roshni, how are you doing? Welcome
Hi, Robin.
back.
Good
Welcome
night.
back. Thanks for coming on the program. It's a pleasure to have you.
I'm glad to be back.
All right. So, Roshni, let's get straight into it. We have a lot of information to cover tonight. But when I was thinking about the different presentations to me as a general practitioner in the field of women's health, one of the more common things we see is uterine fibroids. It seems to be a common problem in Trinidad. There's a lot of misinformation and a little bit of lack of understanding about fibroids. So if you could just tell us and tell our viewers at home a little bit about fibroids, what causes it, how common it is, what are the symptoms that people get, women get, and what are some of the common treatments for this condition?
Okay, so fibroids
Yes.
are non-cancerous growths of the womb.
Yeah.
And the womb itself has three layers.
Yeah.
The inner layer, which is what sheds every month with a period.
Yes.
The muscle, which supports a pregnancy.
Yes.
And then the outer layer.
Okay.
So fibroids all start in the muscle of your womb.
Okay.
Right? And depending on the location, fibroids, if you go to slide 1, you'll see that fibroids could be in different locations. So if it's fixed in the muscle, it's called an intramural fibroid. If it's more than 50% outside the muscle, that's called a subserosal fibroid. And if it's mainly more than 50% projected into the womb itself, the lining of the womb, that's called a submucosal fibroid.
Okay.
And then you have others like pedunculated fibroids.
Okay.
So that it's all the same, it's just different locations, and they have different implications as well.
All right. Before you continue on, how common is fibroids in the population?
Right, so I don't have an exact figure,
Yeah, of
but
course.
actually it is most common in Afro-Caribbean women,
Okay.
and that's based on worldwide data.
Okay.
So we have it very common in Trinidad.
Okay, compared to other countries,
To other
obviously.
countries, yeah.
All right, you can continue on there. Like, what causes it?
So it is familial,
Okay.
right? So it is also enhanced by the estrogen.
Right.
So you'll see that it runs in families.
Okay.
So there's a slight difference between familial and genetic. So it's not in your genes, but familial being it's in the family, in other
Okay.
words.
Okay.
And then there are the symptoms of the fibroids.
Yeah.
So it's very common, right? So the most common symptom is heavy, painful periods.
Yeah.
And with that, you get pain in your tummy.
Yeah.
Some women will then get lower back pain as well.
Right.
If your fibroid is close to your bladder, you get frequent urination because the fibroid is pressing on your bladder and your bladder doesn't have that capacity.
I understand.
So you feel to pee all the time. Then if your fibroid's on the back of your womb, which is close to where your bowels are, you
Yeah.
can actually get constipation.
Right.
And then you can also get pain and discomfort during intercourse.
Right.
And in rare cases, sometimes it will cause infertility because sometimes fibroids can be so big it presses on your tubes.
Right.
If it's inside the lining of your womb, sometimes it prevents implantation, a pregnancy implantation, and it causes miscarriages. Very big fibroids can cause miscarriages around 20 weeks. So imagine that's halfway through a pregnancy and you miscarry because of these huge fibroids.
All right. Does fibroids cause heavy bleeding during pregnancy? I know you said it causes painful
Heavy, painful periods.
Heavy and painful.
Yes.
Why is it painful? Why is it like that?
Okay, so a fibroid basically increases the surface area of your womb, so because your
Right.
womb gets bigger.
Right.
So in so doing, you have a bigger area to bleed,
I understand.
and therefore you have heavy bleeding,
Right.
and the bleeding itself
Yeah.
causes the release of a substance called prostaglandins, and
good.
prostaglandins cause pain, as you know.
Okay.
And the more prostaglandins you produce, the more pain.
Okay.
So that's why you get heavy, painful periods.
All right. So those are the typical symptoms that women might get with fibroids.
Correct, yeah.
I think sometimes in general practice, especially, we may have women coming in with fatigue, weakness, and a lot of times symptoms of anemia.
Correct. Yes.
And usually sometimes someone comes in with those symptoms, we don't really think about fibroids. We check the blood count, and the blood count is a little bit low, and then we realize, hey, let's check and see if there are fibroids or not. So do fibroids commonly cause anemia?
Yes, they do, depending.
Right.
Well, again, because of the heavy bleeding, your blood loss is more than you expect,
right.
and therefore you're losing blood, you become anemic.
Right.
But not everyone.
Not
so
everyone.
symptoms are different for everybody.
Right, right. So are there any other symptoms to the fibroids?
The other symptom is sometimes you feel a weight in your what you call a pelvis, and some people feel their fibroids, so they feel something growing inside.
All right. So some women have multiple small fibroids, and some women have really huge fibroids.
Yes.
Why is that? Is there any reason for that?
So fibroids respond to estrogen.
Right.
So estrogen is what women produce monthly. And everybody's fibroids grow at different rates. Because I've had women where their fibroid was 1 centimeter 1 year and 10 centimeters. I've actually had that where it grew 10 centimeters in 1 year.
Oh, wow.
And then another patient where you keep monitoring year after year and it stays the same size.
Okay.
So it really is the person.
Variable.
It's variable. It has nothing to do with the, genetics or anything like that. It really is that person.
Okay. So what age would it usually start to present in women?
So it is anybody in the reproductive age as well.
Okay.
But uncommonly teenagers.
Yeah.
I've only had one person so far that was 18 and she had a fibroid.
Okay.
But most commonly in late 20s and 30s, you really see it presenting.
Okay. Okay. So let's say someone they have this problem. How do you diagnose fibroids?
So
Other than the symptoms?
right. So well, clinically. So the history, heavy painful periods, having a feel on your tummy because you can actually feel the womb, and then going to special investigations now. So the most common thing would be doing an ultrasound scan.
Right.
And you can actually see the fibroids, the location, the numbers, and you can measure the sizes of the fibroids.
Right.
Sometimes you have to do what is called a hysteroscopy, which is a camera that looks inside the lining of your womb to actually see a fibroid inside.
Right.
And also by laparoscopy,
which is?
a keyhole surgery to look inside the tummy itself. So where you have, but it's not commonly done.
Right.
But it's mainly ultrasound scanning and sometimes incidental findings on a CT scan or MRI. You will see the fibroids as well.
So how do you treat this problem, fibroids?
Right. So in treating fibroids, you're treating symptoms as well as the fibroid.
Right.
So the most common treatment for heavy, painful periods would be what is called non-steroidal anti-inflammatory drugs, which is things like Ulfen, Motrin, Aleve, all that sort of stuff. And there are other medications that help to just lighten the blood flow as well. That's called tranexamic acid. So that's your first line sort of treatment for small fibroids.
So to ease the symptoms there?
You're only easing symptoms there.
There's a slide come up there.
Yes. And following that, the contraceptive pill can be used because the way the contraceptive pill works is to lighten a period.
Right.
However, it doesn't treat the fibroid. So again, it's treating the symptoms of the fibroid.
Right. Which could be very disturbing for the patient as well, because as I pointed out earlier, they can become anemic and they feel weak, they can't concentrate, they can't live life with the same vigor as other people. It might affect studies, university studies and that sort of thing.
Exactly.
Affects their lifestyle. So other than the contraceptive pill, which should limit the amount of bleeding and hence pain as well too.
But you have to remember also that the contraceptive pill, the combined contraceptive pill has estrogen in it.
Right.
So again, while it's controlling your period, symptoms, your fibroid will continue to grow.
Right.
Right. So then you can use progestogens only, which can be a pill. And it can be an injection form.
Right.
And the way that works again is thinning the lining of your womb.
Okay.
So again, it helps with symptoms. And then there's the Mirena coil, which, I mean, I think there's so much information on it now, and it's such a great device because the Mirena coil is progesterone as well.
Right.
But the good thing is, it's actually been showing in recent data that it could halt the growth of the fibroid.
Okay.
So you have a 2 to 3 centimeter fibroid, and Mirena might actually help it to stop growing over the next few years.
Okay.
And the rate of growth, so it may still grow, but the rate of growth slows down.
Right.
Because progesterone counteracts estrogen.
Right.
So it's actually a really wonderful device for fibroids. But the thing about it is, you have to be able to, your womb has to be a certain size, under a certain size.
Yeah.
So a normal womb is about 8 centimeters.
Yeah.
To use the Mirena coil, your womb cannot be more than 12 centimeters.
Okay.
So a key is, if you get diagnosed early, you could use that to prevent the growth. And I've actually had some women where, funny enough, it actually, when I monitored the fibroid about 6 months after, it was slightly smaller.
Right. Is there, just a little bit off course there, right? Is there a rule for like routine ultrasound in women of childbearing age to make sure that the gynecological system is fine and has no abnormalities? Is that part of a woman's, should that be part of a woman's general checkup?
Well, maybe it should be something that's done in Trinidad or the Caribbean, because again, remember we based a lot of our information and
we adapted from
adapted from other
abroad,
countries abroad, the UK
Certainly.
and the US. And though they are definitely genetically different to us,
correct.
their rate of fibroids is a lot smaller.
Right.
So maybe it is something to look at, because it's so common in Trinidad and the Caribbean that maybe we should be doing it for young people, so that if we find it, we could help to prevent that growth. And then the next step, which in terms of treating, would be surgery.
All right.
So again, nobody wants to have surgery.
No.
So if we could prevent somebody's fibroid from growing at a rate where they need surgery,
exactly,
then why not?
Yeah.
Why not?
Yeah. So what are the surgical treatments for a condition? Obviously, there comes a point in time when the fibroid has grown really large, person might be symptomatic.
Correct, yes.
And those sort of pills and so on might have not helped them.
Yes, correct.
And then therefore you have to take a surgical action. What are the surgical options for someone with fibroids?
So it depends on the age group.
Yeah.
So young women of childbearing age or who have reproductive ambitions, you would only want to remove the fibroids. Really
simple question, right?
Yeah.
And it might seem blasé, but what is the reproductive age for a woman?
So
there's a term
once you have...
There's a term that used loosely, but what is the reproductive age?
Right, so from the time you get periods till the time your periods stop, right? So
which could be closer to 50.
50, right. But fertility decreases significantly over 40. So at 40, your fertility rate is actually only 50%.
Right.
Whereas younger than that, it's like 80%.
Okay.
So
my point being that given that somebody's fertility rate is really decreased over 40, do you in your practice see a lot of women over the age of 40 opting to have surgery for fibroids?
Yes, they do. They do.
And that might be the consideration, what I just said there?
Exactly, yeah. So removing a fibroid in the younger age group so that you can you preserve your womb and that you can still have babies.
Right.
So the older woman or woman, and doesn't even have to be over 40, if you know you've had all your kids and you want no more children, a younger person can then move for a hysterectomy, which is removal of the entire womb.
All right. So obviously I made you jump a few steps there, right, in your discussion. So take us through to the different surgical options before you get to hysterectomy.
Right. So the other surgical option would be something called uterine. So before I move on to that, if your fibroid is inside the lining of your womb, you can do something called hysteroscopic resection of the fibroids.
Right.
But it has to be less than 3 centimeters within the womb. So where you just shave away that fibroid from inside.
All right. So the surgeon that's basically goes in and cuts it.
Cuts it, yes,
out.
literally, yes.
Right.
And then you can do removal of the fibroids by opening the tummy,
Yeah.
and again, some people open the tummy because of the size of the fibroids.
Right.
And then there's laparoscopic removal of fibroids, or myomectomies, which is
Right.
what we call it. But that's a special machine called a morcellator that goes away and shaves it away as well. But as far as I know, we don't really have that machine here in Trinidad.
Right.
And of course, you can do it for small fibroids. You can do laparoscopic removal of the fibroids as well.
Okay.
But you do have to cut away the fibroid and then remove it from inside.
Right. Is there ever a surgical indication for small fibroids? You understand what I mean? Because I figure if somebody has a small fibroid, it might not be really affecting them to make them sick.
Yes.
To make them sick and weak, as I said before. So is there really a need for surgery for something that is small?
So I can only give you
is that too cut and dry a question?
I could give you my opinion,
Yeah, go ahead.
which I would agree with you. I wouldn't remove small fibroids.
Because you have to put somebody through
surgery, exactly. So I could only speak for myself.
Obviously.
I wouldn't remove small fibroids.
It's a matter of opinion and discussion with a particular patient.
I think more than 5 centimeters is probably a better size.
All right. Is there, I don't know if I'm using the right terminology, is there embolization of the
Right,
of the
so
fibroid
that's
as well?
it's a non-surgical option.
Yeah.
So it is done. It's where you insert a catheter through your vein.
Yeah.
And so usually they use the arm vein now, and it goes all the way down to the womb, and then they send little pellets through that to cut off the blood supply to the womb. And so that's
to the fibroid?
No, to the womb.
To the entire womb?
To the womb, and then, well, because the fibroids are part of the womb, it literally cuts off the blood supply, and it shrinks the fibroids.
What age group is suitable for that?
So there's no real particular age group for that, right? So it depends on the woman's, again, reproductive age.
All right, so our next question is, if you're cutting off the blood supply to the entire womb, is there not complications for someone?
Right.
It's not, that's not just a specific treatment for a fibroid, that's effect. Is there a side effect?
Well, it doesn't, you don't cut off the entire blood supply. So you cut off major blood supplies. Yeah. So it does shrink the womb and shrink the fibroids within the womb.
Okay.
But because it's still a fairly new, well, it's not that new a procedure. It's been over 10 years.
Right.
The radiologists were a bit cautious of it in terms of pregnancy.
Of course.
Because although we know women can get pregnant after doing the uterine artery embolization, and I have seen it in Trinidad as well, they're fearful that somebody who can't get pregnant after will come back and say, well,
it might be
you caused my infertility.
But that doesn't happen really often, does it?
It doesn't.
Okay.
So
because that could happen to anybody, and anytime you do surgery on a female.
Yeah. But I think most of the times, if somebody says that they want to have kids, you may not really sway in that direction of uterine artery embolization.
Okay.
You more tend to go with removal of the fibroid.
Okay. Roshni, we have to take a little commercial break now. Okay. And when we come back, we'll discuss a little bit about the other surgical procedure, the big one, the hysterectomies and so on, and the indications for that. All right, guys. So we're here with Dr. Roshni Bissoondatt. We're talking about obstetrics and gynecology. We're going to discuss a few little different topics in the field of women's health. I hope you enjoy the program. And I would just like to officially invite you to send in your questions. And we'll do our very best to answer them as best as we can. And so please send in your questions. All right, guys, we'll be back in one moment.
Don't forget who you are and whose you are. If it doesn't scare me, it's not big enough. I'll never be the same. Never, never, never. I'll never be the same. In Jesus' name.
Hi everyone, I'm Stacy from Stacy's Kitchen. Check out our new episodes, Season 3 of Stacy's Kitchen at our new time, 5:30 p.m. on Mondays and Wednesdays, right here on ACTN The Voice. I will be whipping you up some flavorful and appetizing dishes. As they say, good food makes a good mood. So guys, stay tuned for this culinary explosion right here on Stacy's Kitchen.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Dr. Roshni Bissoondatt and we're discussing women's health. So, Roshni, before we went to the break there, we were talking about the surgical options for fibroids, right, for women who suffer from this condition. And you finished off, you talked about embolization of the fibroid, you talked about laparoscopic option, you talked about a shaving option of the fibroid itself, and an open option in case the fibroid is really big. At what stage do we reach the stage of somebody deciding to have a hysterectomy done?
Right, so a hysterectomy, as everyone may know, it's removing your womb.
Yeah.
So, so somebody who doesn't want to have any more kids, that's the better option.
Yeah.
So, because it also eliminates other issues later on in life. So while you're removing the fibroids, if you do a hysterectomy, you remove your risk of things like cancer of your womb, cancer of your cervix, cancer of your ovaries later on in life. So somebody who really doesn't want to have kids, the better option is a hysterectomy.
All right. Other than someone who does not want to have kids, I mean, is it also related to the significance or the degree of the illness itself as well? For example, somebody has massive, huge ones and multiple fibroids.
Right. So yes, that's correct. So some women have had fibroids all the way up to the tummy where you think you're full-term pregnancy. And that means you have huge multiple fibroids. So it's not to say that you have to do a hysterectomy, but your risks doing removing of the fibroids is a lot higher in terms of heavy bleeding.
I understand.
And in that case, if you are bleeding very heavily, you may have no choice but to convert to a hysterectomy. So it is not always to do with the size of the fibroid. I mean, we have to preserve women's rights as well.
Of course, and you don't want, but I suppose if somebody is significantly anemic, you might have to do it out of ability to preserve life too sometimes.
Yes, because if you can't be able to regain your blood count.
Yeah.
But you could still possibly try just removing the fibroids rather than going for a hysterectomy.
Okay.
Again, at the time of surgery, you might have to make that decision to do a hysterectomy if, depending on the location of the fibroids, how much of the womb has had to be removed
so
with the
you said at the time of
fibroids.
surgery, what do you mean by that?
So although you might do an ultrasound to see the size of the fibroids and the location, it's not always that accurate.
Right.
So when you actually are doing the surgery.
What surgery? This is one of
This
the
is
other the earlier surgeries.
The earlier surgery is talking about the removal of the fibroid alone.
Yeah.
If you're bleeding heavily at the time of the surgery, or the fibroids are located so many different places, and you had to cut away a lot of the womb, and when you look at it and it's like, well, this is not much womb remaining,
I understand.
You might then have to do a hysterectomy.
Hard question. So is it that sometimes while you actually do it, while a person is undergoing surgery, that they bleed a lot?
For fibroids, yes. And this is why when you're doing fibroid surgery, we always recommend that you have at least 2 and sometimes 4 blood donor units of blood available for the surgery.
I understand.
Yeah.
I understand. So you mentioned a procedure they call a hysterectomy, right?
Yeah.
It seems like, I mean, I've started practice about maybe general practice about 15 years now, and a lot of the older patients who come in, you always hearing that they had a hysterectomy done, this one had a hysterectomy done, and I don't know if everybody really on the same page, right? If they really had a hysterectomy done, and nowadays it seems that you might leave in the ovary, or you might even might not have had a full hysterectomy done, but although we use the term hysterectomy loosely, just explain those terms and the different types of, not necessarily hysterectomy, but different types of surgical procedure along that line to the audience.
Okay.
You understand my question?
Yes.
Yeah.
So hysterectomy means removing the womb. So the womb consists of what you call the body of the womb plus your cervix. So the cervix is the mouth of the womb.
Right.
So that is what is called a hysterectomy.
Right.
If you decide to leave the cervix, that's called a subtotal hysterectomy.
Right. Next big question: why would someone opt, or a surgeon opt, or a patient opt to have a cervix remain in and rather than taken out?
Okay, so if at the time of surgery it looks as though if there looks as there's going to be damage to what is called the ureter, which is
Yeah.
the connection from the kidneys to the bladder,
Yeah.
the ureter runs alongside your cervix.
Okay, so
so
you get-
sometimes
Yeah.
the anatomy is so
Oh, I
distorted.
get your point. That
And-
up for safety.
Yes, for safety, sometimes you
Yeah.
actually just have to
Oh,
leave
yeah.
your cervix.
I
So
understand.
that's at the time of the surgery.
Right.
And some women opt to leave their cervix.
Right.
And this is really for sexual pleasure.
Right.
Because there's one study that was done in France that
Yeah.
showed that women who left their cervix had
Yeah.
better sexual pleasure.
Yeah.
But all other multiple studies did not show that. So,
Okay.
which is why the woman has to make the decision whether she
And
wants it or not.
these women who leave the cervix, they need to have pap smears done as
They
well.
would have to do their pap smears until the age
So
of
basically why I'm
65.
hammering that in is because from my experience, sometimes people don't know what type of surgery they had. They don't know if the cervix was removed or left in as well.
Right, yeah.
And that's why it's sometimes very important to know what's happening and communication. And best people need to know because some people think they had everything removed or might not have had everything removed, and
Yeah.
they might need to, and they need to know they need to get pap smears as well.
Yeah, and the flip side to that
The flip side, yes.
is that they had their womb and cervix removed,
Yes.
and they continue to go for a pap smear, but there's no cervix.
Right.
So you don't need a pap smear.
Exactly, you don't need a pap smear. All right, so let's explain some more the other type of procedures that you have in terms of a hysterectomy.
Right, so at the time of a hysterectomy,
Yeah.
over the age of 45,
Yeah.
we do recommend removing your ovaries as well. So that's not part of the hysterectomy, but that's called oophorectomy.
Okay.
But it's generally done together
Yeah.
because remember menopause is
Yeah.
the average age is around 51.
Yeah,
And that means your ovaries are going to fail anyway.
yeah,
So if you're close to menopause, it
Yeah.
doesn't make sense leaving your ovaries
Right.
because there is a lifetime risk of you developing ovarian cancer in
Right.
your lifetime,
Of
right?
course,
So
yeah.
it's 1 in 70.
Yeah.
So eliminate that risk. We do recommend removing the ovaries at the same time.
all right. That's usually women over the age of 45.
Over
or so.
45, definitely. We
Right.
do recommend it
Right.
medically.
Right, and these women probably perimenopausal.
They are,
A lot
yeah.
of times approaching menopause and have different symptoms. And is it that after you remove the ovary, they put them on medication, hormones, or anything like that?
Yes, so
Okay.
you become instantly menopausal when you
Yes.
remove your ovaries.
Yeah. Is that a sudden dramatic change? Do they feel a sudden dramatic change?
It's variable. Some women, they 2 days after they say they feel the symptoms, and other
Wow.
women say, well, they didn't even know.
Right.
They didn't feel it until
Right.
you came to the office and then you put them on the hormones.
Right.
Now,
So what do you do for them? What treatment do you give them after?
so you give them, you replace it, your
Estrogen?
estrogen,
Okay.
estrogen only,
Okay.
because you don't need progesterone once you have a hysterectomy.
Okay.
And a study out of the United States showed that women who went into premature menopause,
Yeah.
there was an increased risk of heart attacks
Okay, because it lack of estrogen.
because of the lack of estrogen. So we know now that estrogen protects women against heart attacks
Yeah, for sure.
only until the age of natural menopause.
Only until the age.
Natural menopause.
Right.
So after 50, 51,
Yeah.
estrogen no longer protects your heart
Yeah.
because then age kicks in and you're
Yeah.
just at risk like anybody else.
Right.
So this is why anybody who generally has a hysterectomy or have had ovarian failure for some other reason,
Yeah.
under 50,
Yeah.
we do recommend taking the estrogen hormones until the age of 50,
Right, for
51.
the other medical benefits other than just
And
your field,
osteoporosis.
and osteoporosis. as well.
Osteoporosis for sure, because estrogen protects against osteoporosis
yeah.
lifelong though.
Yeah, I think we all
Yeah.
know that. So those are the major hysterectomy type procedures.
And then, well, the
And
other,
plus or minus additions.
right, and then, well, we didn't mention about the vaginal hysterectomy.
Yeah, what is that?
So that's a hysterectomy that's done from down below or vaginally. So there's no
Yeah.
cut on your tummy.
Yeah.
Everything is done from the vagina.
Okay.
And that's usually done for prolapse. So
Right.
women who has their womb is starting to come down,
Right.
you would do a vaginal hysterectomy.
All right.
Although, for some women who want a laparoscopic hysterectomy,
Yeah.
you can do what is called a laparoscopic assisted vaginal hysterectomy. Or
Right.
even so, you can do a laparoscopic hysterectomy.
Okay. After a woman has a hysterectomy, right? It's major surgery.
It is, yes.
Are they down for, how long would they be down for, and how do they feel afterwards, and when do they get back to being able to like go back out to work and looking after kids and doing their chores and so on?
Right, so
the normal daily living.
Daily
How long would it be down for?
average is 6 weeks.
6 weeks?
6 weeks definitely for a tummy surgery.
Yeah.
It could be a little earlier for a vaginal surgery. So 4 to 5 weeks for vaginal, but we don't advise too much heavy lifting during that time though, because if you had a prolapse and you stress by lifting heavy things, you can get a recurrent prolapse. So on average, we would say 6 weeks for everybody.
All right, so I'm going to ask you some really simple questions, but it's something that everybody wants to know. How long does the actual procedure take when you're doing a hysterectomy?
Oh gosh, that's variable.
Right.
So it could be anything from, some surgeons take 45 minutes, others take average, say, an hour and 15 minutes.
Right.
But then again, it depends on how difficult it is, because if you have a lot of fibroids,
that's a general question.
I would say average an hour and say hour and a half.
Okay. And after the surgery, the lady goes back to the ward, and how long does the lady have to stay in hospital?
So again, that's variable. In general, I would say, well, when I operate, my patients usually will go home after about 36 hours. Okay. So if I do it one morning early, say 7 o'clock, they usually will go home by 5 o'clock the next evening. Okay. But I know on average a lot of people do stay the full 48 hours. Right. And some surgeons are just very cautious that they will keep some patients 3 to 5 days. Right.
And after the procedure, when they go home, they're able to ambulate and walk around?
Well, you have to be able to ambulate before you leave. Yes. Yeah.
So it's encouraged nowadays, isn't it?
It is. Yeah. The day after, because of the risk of blood clots in your legs. So we do.
So I really digressed there a little bit, but it was important questions that the average man and average patient would ask, right, before they go for a procedure. I just want to move a little bit away from fibroids now. I just want to ask you, another condition that I think is sometimes poorly understood in terms of symptoms, because the symptoms could be so wide, is endometriosis. Okay. Let's tell us a little bit about endometriosis, the symptoms especially, because things sometimes don't present like they do in the books or the internet. Some patients might be suffering with this condition, and some doctors as well might not be accurately honing in onto the diagnosis. So if you could just give us a little bit of education about the symptoms and what is endometriosis.
Okay, well, endometriosis is when the lining of your womb, which is what sheds every month with a period, it's called the endometrium. Yes. When it is in abnormal places. So instead of it being in the lining, it's outside of the lining, and that causes different symptoms. So the most common place for it to be is in your tubes or ovaries, so ovaries. And if it's on your ovary, every month when you are having a period, that little spot is bleeding as well. So you get a cyst, or you get blood or bleeding into your ovary. Right. And of course you will get pain because you get stretching of the ovary. That's causing that pain.
So that basically explains why endometriosis is such a painful condition.
Yes.
It's a painful condition.
It's painful. It's very painful. So that's one of the symptoms is pain, monthly pain. Right. And that pain usually will start from 2 weeks before a period, because that's the time of ovulation and when your hormones change. Right. So you start to feel it from 2 weeks before a period, and gradually towards the period you might notice, oh, this pain is getting a little worse every day, and close to the period, it's bad. It can be very bad. All right. First day of your period probably is also very bad symptoms like the bleeding and the pain. Right. And then it tends to dissipate during the period.
All right. Other than pain, is there any other symptoms that women get?
So again, heavy period, because the lining is in abnormal places. Right. It could be in the womb itself. So the muscle of the womb, and that's called adenomyosis. So again, your womb gets bigger, and that causes heavy and painful. All right. The other symptoms.
I think there's a slide there, Josh. You could put it up there first, please. What is endometriosis? Tell us.
Right. So the other symptoms would be painful. So endometriosis could be on your bladder.
Oh, thank you, Josh.
It could be on your bowels. It could be anywhere inside. So if it's on your bladder, you can get painful, frequent urination. Yeah. On your bowels, you can get frequent bowel movements. You can get diarrhea sometimes. You can get constipation sometimes.
You see, that's why it's important for us to tell people about this condition, right? That's right to interrupt. You can put back up the slide, Josh. I'll talk over it. The reason being is that some of these symptoms are so suggestive of digestive problems. They're so suggestive of infections.
Yeah.
And I think the key part of it is, if you're not recovering from your symptoms, keep looking
for something else.
Keep looking for something else, and don't give up.
Correct. Yes.
Because this is diarrhea, constipation, nausea, lower back pain. I mean, that could be. The first thing that comes to your mind is certainly not endometriosis.
Yeah.
If you're a patient, somebody from the public, or a doctor, you could go on there, doc.
And then also painful intercourse.
Yeah.
So, I mean, sometimes people don't believe the type of pain that women go through.
Yeah.
And when somebody's telling you that they're having painful intercourse, that's definitely one of the diagnoses we think about is endometriosis.
Yeah.
And infertility. So if you have endometriosis in your tube,
Yes.
you get what is called scarring of your tubes or adhesions in your tubes. And then your tubes get sticky, they get stuck together, they get closed off. And a lot of women aren't able to get pregnant
Okay.
because the egg and the sperm meets in your tube.
Right.
So if it's blocked,
I understand.
it
sounds very
causes
logical,
infertility. Yeah.
We've hammered at some real hardcore physical symptoms, right? Is there any other subtler signs that somebody might be suffering from endometriosis and or fibroids? How do women feel? How do they feel today? I mean, is there emotional component? Is there
So, okay, so
give us a
some
more
women do
holistic
get,
feel other than
they get fatigued
Yeah.
because of the anemia sometimes, because of
Yeah.
the heavy, painful periods. They get a bit despondent because they're thinking they're having pain with intercourse.
Yeah.
They're uncomfortable because they
Yeah.
have this underlying pain all the
Yeah.
time.
Yeah.
And some women who have bad endometriosis, the pain isn't even only the half of the cycle. It's every day, every month.
Right.
You're having pain.
Right, that's important as well.
Yeah.
To hear that it might be every day of the cycle.
It could be. It could be. So very bad endometriosis causes pain every day.
Right, right. Can it certainly? For example, some patients come into my office and they say, "Well, Dr. Robin, like sometimes I just bleed, and it's not related to my cycle. Can that be endometriosis or
Yes,
fibroids?"
so you get intermenstrual bleeding. Yes,
Yeah.
so unrelated to the actual period, you could have bleeding in between your periods.
Right.
Not as common. People will have bleeding with intercourse,
Right.
but it's mainly the pain with intercourse.
All right. So I've asked you a question. So what other symptoms or what other causes, gynecological causes, could give someone bleeding outside of their normal cycle?
Okay, so we spoke about fibroids
Yeah.
and endometriosis.
Yeah.
So other causes will be something called polyps.
Yeah.
So you can have intrauterine polyps.
Yes.
So that's a little growth inside the lining of your womb.
Yeah.
And that doesn't respond to your hormones as the normal lining. So you can get bleeding from that. You can get hormonal issues. Things like thyroids causes irregular bleeding.
Okay.
Polycystic syndrome can cause irregular bleeding.
Okay.
Other medical conditions. So patients on steroids really,
Okay.
they can get irregular bleeding as well
Okay.
because that's the hormonal component.
Very good.
High prolactin, but that more causes skipping of periods, not the bleeding in between the periods.
All right. And is there any other medication other than steroids that could cause bleeding? Not really, no?
Not really.
All right, that's
Yeah,
fine.
it's more,
That's fine.
yeah.
That's fine. So I'm going to take you back to the endometriosis now. So this you have a patient, you complain that. All right. Well, Judge, that's telling me time for a commercial break.
Okay.
So we're going to the diagnosis after the commercial break. All right. So guys, we're here with Dr. Roshni Bissoondatt. Please send in your questions. Ask us any questions or your comments, and let us know what you think about the program tonight, and get involved in the discussion, please. So we'll see you back in one moment.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
Welcome back. So, Roshni, so we were talking about endometriosis. You give us the symptoms. How do you diagnose someone with endometriosis?
So sometimes it's actually really difficult to diagnose the endometriosis
Yeah.
because people have different symptoms.
Yeah.
So some women will have that heavy, painful period.
Yeah.
Some people will have the bladder symptoms, the
Yeah.
bowel symptoms. And this could mimic, remember things like irritable bowels
Yes,
and
yes, yes.
pelvic inflammatory disease. Some women have no symptoms at all.
Yeah.
So in investigating someone, we usually will do an ultrasound.
Yeah.
But an ultrasound doesn't always, so let's start with a pelvic exam.
Yeah.
So in examining someone, you might feel that the womb is a little bulky.
Yeah.
It's tender, so endometriosis always causes pain.
Okay.
You can actually feel this thing called endometriotic nodules in the vagina,
Yeah.
and they're also tender. So it's actually like a little tiny, it feels like a teardrop.
All right.
But it's just full of that blood and it's tender. So when you do an examination, that is, you can feel that. Then the next step is going on to an ultrasound. An ultrasound cannot diagnose small endometriosis, but it can actually see endometriosis on an ovary.
I understand.
And that's called an endometrioma.
Okay.
So when you see that, then you know that person
Something's
has,
happening.
yes,
Yeah.
you have endometriosis.
Yeah.
But what you call the gold standard
Yes.
for diagnosing endometriosis is called a laparoscopy.
Okay.
So that's a keyhole surgery, with a camera inside the tummy, and you actually see the endometriosis.
Okay.
And uncommonly, an MRI can also see endometriosis.
Okay. And just really briefly, how do you treat endometriosis?
So the treatment of endometriosis is very similar to fibroids. So
Okay.
you're treating symptoms, so your
Right.
heavy painful periods. So you can use things like your normal painkillers. One of your first line treatments would be the contraceptive pill.
Right.
But we don't use it normal, like how we normally take a monthly cycle.
Yes.
The traditional way we use it is called tricycline.
Okay.
So you have a period every 2.5 months instead of having a period every month.
Okay.
Because when you do that, you prevent ovulation and
Yeah.
you prevent that endometriosis collecting every month.
Right.
And it gives your body time
What do you
to
mean
dissolve it.
endometriosis collecting every month?
So remember, every month when you have a period,
Yeah.
those spots bleed.
Yeah, right.
So
right.
if you are not having a monthly period,
Yeah.
therefore you're not bleeding monthly, you might bleed every 2.5 months.
So you have a dissipation of symptoms.
Right. And not only that, it gives your body, so to get rid of endometriosis, naturally your body has to not have a period.
Yes.
And your body internally gets rid of that endometriosis.
Okay.
So you could call it dissolving it,
Right, yeah, the body heals itself. so
heals
to speak.
itself.
Okay.
So that's one way,
Right.
using the pill you call tricycline.
Yes.
The Mirena coil
Yeah.
also, again, a fantastic device because, again, the Mirena coil works in many ways. One, it suppresses ovulation, so it works like a pill. It thins the lining of your womb. It counteracts the estrogen again, and therefore it helps to get rid of endometriosis because some women don't have any periods at all while they have the Mirena coil inside.
Exactly.
So then you can have
So the body
3 to
gets
5
used to it.
years,
Yeah.
and your body gets rid of. They have a longer time to get rid of the
I understand.
endometriosis.
Obviously, beyond that, what other treatments are there?
Well, there's still other medical treatments.
Okay.
So there's a new pill that's out. It's progesterone only. It's
Yeah.
called Visan.
Yeah.
And that one can be used more long term.
Right.
It's a bit expensive, but it can be used.
Okay.
So it's a daily pill you take.
Right.
And again, it prevents ovulation. It prevents you from having a period. So
Right.
therefore, it helps to get rid of it.
Okay.
And then one of the best medical treatments would be something called the GnRH analogs. Fancy name for putting someone into a menopause. Because when you go into menopause, you literally don't have any estrogen, you don't have periods, and therefore your endometriosis goes away.
Okay.
So those are the medical treatments. And then you have surgical options, obviously, which is removing the endometriosis. So you can do that laparoscopically. Some people do it by what is called diathermy or burning.
Okay.
Some people use laser.
Right.
Some people cut it away.
Okay.
So all those are different
Basically
ways.
getting rid of it, physically getting
Getting rid of the endometriosis.
And I suppose that's done in combination with your other treatments as well.
Yeah, because if you find somebody that has endometriosis early enough, and again, I just use a dimension. So if you have an endometrioma that's less than 5 centimeters, you probably will have a good chance of using medications to get rid of that endometrioma.
To give the body chance
yes,
and
and not have to move to surgery.
I understand. So early diagnosis is
Early
important.
diagnosis, yes.
Good. Josh, I think we have some feedback there from the audience. If you can get into that. I had a fibroid in 2019. It was the size of a 2-month-old fetus. I had no symptoms and only found out via a checkup. I changed my diet, and 6 months later, I did an ultrasound, and there was no fibroid. What could have caused this? That's interesting. Does our diet help us with the treatment of this condition?
Yes, it does, because again, estrogen.
Good question.
Estrogen promotes the growth of fibroids.
Right.
So what a lot of people don't realize is that chicken has a lot of estrogen.
Oh, yeah.
And chicken is a staple in Trinidad.
Oh, yeah.
And I couldn't believe when people were telling me they were eating chicken 5 times a week. And that promotes the growth of a fibroid, as well as other estrogen-containing foods. So things like tofu, soya, that sort of stuff have high estrogen levels.
So what you're saying to me is that someone who really radically changes their diet towards low hormones can actually basically starve the fibroid itself of what it needs to grow, and therefore they will have slow growth. Would they have it shrinking though? I mean, medically, to me, that I'm thinking, well, if it's solid, it shouldn't. But I actually have seen it. Right, so what that viewer does put, that case that the viewer put to us makes logical sense.
Yes,
then. So their diet probably did help them.
Yeah, it did.
But what did it say, a 2-month-old fetus?
So 2 months is 8 weeks. It's small. I mean, but
so diet will help.
Diet will help.
Okay, good. So that's good to know. That's good information for everyone to know that the diet is extremely important in this condition. Joshua, you could put up the next one, please. Are pap smears is a very good question. Are pap smears necessary after the age of 65?
So that is a very good question, because internationally, the guidelines suggest that you can stop doing pap smears at the age of 65. However, last year, a new paper came out that showed that there was a fair incidence of women between 65 and 75 with cervical cancer.
Right.
And I don't know if we want to talk about that later or now, but cervical cancer is due to the HPV virus. So what I always tell my patients is, if you have a change in sexual partner over the age of 65, definitely do a pap smear. Because let's just say somebody gets divorced, their husband passes away, you have different reasons, you have a new partner, and you may not have been in contact with that virus at that point, and you now have a new partner. You are at risk. You can get the virus and you could develop the cervical cancer.
So maybe what is your unofficial, non-textbook recommendation to our population in terms of pap smears?
So
in terms of time, age, and how frequently?
Right. So I still follow the international guidelines a bit in the sense that it's every 3 years up until 50. Every 5 years after 50 until the age of 65. And I would say if you don't have a new partner and you're fairly sure that your partner does not have anybody else, you can stop doing your pap smears at 65. But if you are in doubt or you have a new partner, go ahead and do it until at least 75. And the guidelines may change in the next few years. You don't know.
Yes, George. Can fibroids turn into cancer?
That's a very good question. Although we say fibroids are benign, it's a very, very rare occurrence that it can become cancerous.
So it's extremely rare.
Extremely rare. Extremely rare.
Josh? What is the role of herbal medication in treating fibroids, aka melting the fibroid? doctor? That's a good question. Is there any sort of, I mean, beyond that, with the reduction in the estrogen containing foods, this viewer is asking, is there anything else that I may take, herbal supplements as well, that may help shrink the fibroid?
So I wouldn't dispute herbal medications, because although we study medicine and we know we know the drug, we don't know where that drug is extracted, because again, it's all about
it's about purity and the concentration of the
concentration,
drug.
and we simply don't know where some medications come from. So it could be coming from the herbs. So I would say if you know someone who has used it and they have good results and they have no side effects, by all means go ahead and try it.
All right, but there's as far as, I mean, it's, I mean, putting it out there, but your knowledge of the field would be very limited because of the nature of the medicine you practice.
Herbal medications,
Are uterine fibroids a marker or risk factor for any other malignancies? Is there any relation between fibroids and any other cancers in the body?
No.
Okay.
No, not as far as I know. It's more breast and ovarian, and those things are linked, endometrial, but not fibroids.
Okay. Can a IUD device cause fibroids? 2 months since I have had this inserted and I am bleeding ever since. Let's speak generally to that question there. So basically the first part of the question is, can the device cause the fibroids? And the second thing is, can cause fibroids? You're not saying this person has fibroids. And then the second part of that question is, this person had the device put in and they're bleeding.
No.
You understand that question?
Yes, so an IUD...
It's two separate things that may or may not be linked. An IUD won't cause fibroids. Yes.
But putting in an
because IUD... Because an IUD might be used to treat fibroids.
Right. So the hormonal type.
The hormonal
Remember, there's a copper IUD as well.
Right, but is copper IUD still used routinely?
Yeah.
Okay.
Yeah, we still have it available.
Okay.
So that's the only non-hormonal contraceptive on the market, really.
Okay.
Right? So the IUD in itself will not cause, whether it's copper or marina, will not cause a fibroid.
Right.
The fibroids
or affect its growth. It's increased in size if you have
wouldn't increase it.
Right.
So an IUD will not do anything to fibroids if you have fibroids.
Right.
The IUD itself causes heavier periods.
Okay.
Right. So it's not doing anything to the fibroid.
Okay.
But the marina will lessen, it could halt the growth of a fibroid and shrink it a bit.
Right.
And in terms of irregular bleeding, yes, an IUD can cause irregular bleeding initially when it's inserted. It's very common.
Okay.
And you have to give it at least 3 months to see whether it settles.
Okay.
That's usually for the IUD, the copper IUD. And in Mirena, the data says you should give it at least 6 months.
Okay.
But during that time, if somebody's bleeding doesn't stop, you can do other hormonal manipulation with the Mirena to just cycle and give it the 6 months. And if it doesn't settle by 6 months, the recommendation is to remove the Mirena.
Okay. All right. Josh, any more questions there? Is it possible to mistake being lactose intolerant or getting upset with certain types of food for symptoms that are typical of endometriosis? I think yes.
Yeah.
That's what I was trying to hint at.
Correct, yeah.
Earlier on, that they have so many different conditions that might be related, that you might think, and you go down one, what do you call it, a rabbit hole.
Yeah.
And you need to really keep your eyes open and look around all the time to make sure that you're not missing something else. And endometriosis is one of those conditions.
Yeah,
guys.
and it's unfortunate that sometimes the only way to truly diagnose endometriosis is the laparoscopy. Because you might have all these other symptoms, and the only way to rule out sometimes endometriosis is a laparoscopy. However, something that I sometimes do is do a treatment as though it's endometriosis and see if your symptoms get better. And if it gets better, then you actually thinking, look, you do probably have endometriosis. And it's up to the patient to decide whether they want to truly know by doing the laparoscopy. But if your symptoms improve on medications,
the ultimate aim is to feel good.
To feel better.
They might not want a definite diagnosis.
All
right, so I think we're out of questions there, Doc. We have about 2 more minutes. I just wanted to just touch briefly on pap smears, right?
Okay, so...
About 2 more minutes, if you could just tell us a little bit about pap smears and take it from there.
So, I don't know if everyone knows, but this is the month for cervical cancer awareness.
So now they do.
So, it's important to do pap smears because it's a test for, or screening test for pre-cancer. And if you pick it up, you can treat this 100% and get rid of it before it turns to cancer. Now, cancer of the cervix is due to the HPV virus, which is sexually transmitted.
Okay.
So for somebody who is not sexually active, your chances of getting cervical cancer is probably 0, right? But it's the HPV virus that causes the cervical cancer. But not everybody who is going to get the HPV virus gets the cervical cancer.
Okay.
So there's a group of women where there's an immune defect, and that is where it runs in families.
Yeah.
So women in that family might have this immune defect where they are not able to get rid of the virus.
Yeah.
So what I like to tell people is, think of it like a cold. When you get a cold, your body has to fight it off. When you take things for your cough and your runny nose and stuff, you are not treating that virus or that cold.
No.
You are treating the symptoms.
Yes.
It's the same thing for the HPV virus. Your body is supposed to fight it off, and the majority of women do fight it off.
Okay.
And 60 to 70% of the population will come into contact with the virus at some point in their lifetime,
Right.
but you clear it, you get rid of it.
Right.
Those are the women who have the immune defect, cannot get rid of it.
I understand.
And those are the women who possibly will get cervical cancer if they don't do their pap smears.
Right.
So if you do your pap smears, you screen,
Yeah.
you pick up the pre-cancer, you can treat it.
Right.
And the treatment is removing the abnormal cells.
Right.
And something I'd like to mention as well is
Right.
that we do have the new vaccines for HPV. It has been proven to work worldwide, and if you
Right.
look at the data coming out of Australia, they gave it to all their young people,
Yeah.
men and women, boys and girls,
Yeah.
and their incidence of cervical cancer has decreased significantly.
Right.
So because there's no test for this immune defect,
Yes.
it's given to everybody.
Okay.
So it boosts your immunity, and so if you do come into contact with the virus, you can get rid of it.
Okay. All right.
So it's about protecting yourself
And getting your pap smears
and
done.
getting your pap smears done.
All right.
And what I do tell women is, if you have a change in sexual partner, this is really for the young woman, don't wait 3 years. You might want to do it probably a year after with a new person.
All right. All right. Well, Roshni, we're all out of time. Just like to thank you for coming on the program tonight. You know, a lot of interesting information for the public on these, especially fibroids and endometriosis. Right, guys, so that's it for tonight. Just like to thank Roshni, Dr. Roshni Bissoondatt again. Hope you enjoyed the program. We didn't cover as many topics as we would have liked because Dr. Bissoondatt really went in depth in a few conditions that we spoke about. I hope you enjoyed it. Hope you learned a lot. And yeah, well, thanks for joining us tonight, and we'll see you again next week. All right, guys, so take care. Keep safe, and God bless. We'll see you again next week now, guys.